healthcare and mobile health applications. I will start with a couple of technical issues, but then we'll move to focusing on human-computer interaction with conversational agents in healthcare. So this slide is to actually demonstrate you the actuality of the topic. So I just conducted the literature review where I identified conversational agents in healthcare. So it was conducted in April. And you can see that in 2021, we had almost more than 90 healthcare chatbots where research publications were published. Out of our one, we had a total of 181 conversational agents collected in this process. So there is some hype around conversational agents in healthcare. And in the next few minutes, we will learn more about this. So actually, the topic of conversational agents or chatbots is not new. There's this old-fashioned ELIZA chatbot, the first one that has been programmed by Joseph Weizenbaum, a German computer scientist. And ELIZA was actually simulating a psychotherapist. So she was designed to imitate the therapist who would ask open-ended questions and even respond with follow-ups. So as you can see it in the slide here, it is kind of pattern-based. The user said, I'm depressed. And so ELIZA took up this term that was recognized and formulates a question out of it to keep the conversation ongoing. So ELIZA was not very intelligent. She was not capable of passing the Turing test. So the test of, if you can't say whether you're talking to a person or a machine, the machine passes the test. So, but here with ELIZA, it was not possible. But a couple of years later, so actually this chatbot here is the one of the chatbots who was capable of passing the Turing test, which is conducted in this Löbner Prize competition. So Cookie or Mitsuki is a chatbot who was able to win this prize. It actually won 5 times this prize. And it is an embodied artificial intelligence-based chatbot. And well, I challenged it a bit by asking some medical questions. So I asked her, what is asthma, as you can see here? And she knows some terms about this, but when I'm asking about treatment of asthma, she just failed. So I was not convinced that this is a human, but you can try it on your own. There's also a more fancy version of Cookie on YouTube. So you can chat with her and she will do some moves in the YouTube channel. But now I would go, as promised, to some technological background. So what is actually a conversational agent or conversational user interface? And this is actually a collective term for a variety of systems that mimic human conversation. So we have a couple of terms there related to conversational agents. We have chatbots, which are conversation systems that interact with humans via a natural language that might be text or spoken. There are virtual assistants, which are quite similar to chatbots, but they are implemented for a specific role in helping users. So they have a specific task they are working on. Then there are interactive voice response systems. These kinds of systems you probably know when calling some hotline, for example, the airline hotline, then some voice is asking you questions and you have only a very limited number of potential responses. Often these are just numbers. So this is what we call interactive voice response systems. So they are not really intelligent. And at the end, we have voice activated personal assistants, which are also called voice user interfaces. And these are virtual assistants that operate through a dedicated hardware device. So for example, through smartphone speakers, as you know, for example, from Apple Siri or Alexa or Microsoft's Cortana. So these kind of systems. what is so interesting about conversational agents is that they are supposed to be more intuitive. They can, to a certain extent, adapt to users, and they try to deliver support to users as it is impossible through fixed screens, as we know it from other types of applications. So just to elaborate a bit more on the specific characteristics, so I mentioned already the main characteristic. It's a dialogue-based interaction realized through conversational agents, and it is realized actually through different communication modalities. So it can be written, so you're just chatting, by text, by using free text. You can speak to these systems. Some systems integrate visual communication, others are using haptics, or of course, combinations of all these types are possible. Then conversational agents are distributed through a service channel that might be social media. So we have a couple of systems running on, for example, Facebook or WhatsApp Messenger, but they can also be distributed through smartphone embedded software, through a website, and so on. Conversational agents support a variety of interactions. So for example, they can also provide access to other services, open websites, or help to interact with other devices. And another characteristic is that they are based on an intelligence framework, which might be rule-based or based on machine learning. Rule-based systems use a predefined set of patterns. So as a developer, we have to develop these patterns and rules, and also have to define potential responses so that the system is then able to do some pattern matching, and based on the pattern matching is able to select an appropriate response. So rule-based systems rely on manually created rules and patterns. Then we have machine learning-based systems. These systems match user input with trained models to identify relevant responses. And finally, there are artificial intelligence-based systems that use a couple of methods like natural language processing, machine learning, and so on, to really understand what the user is saying, not just matching patterns, but to really understand user input, interpret it, and then come up with an appropriate response. So when we have artificial intelligence in conversational agents, as I mentioned, it might be machine learning or natural language processing integrated in those systems. With natural language processing, we analyze the natural language. So when the user is entering some text, this is analyzed with respect to entities that are mentioned, with co-occurrences of terms, relations among entities are determined, and so on. So typical natural language processing tasks. And this is needed to determine intents that are expressed, to classify emotions or other semantics hidden in a user statement. Machine learning is then used to learn from data. So we can also use machine learning to recognize patterns. We can also use it to generate responses on the fly. So we don't have to necessarily formulate all possible responses, but they can be their natural language generation technologies available based on machine learning that can be used to generate even answers on the fly. But when using machine learning in conversational agents, we have, as often with machine learning and artificial intelligence, the burden of training data. So we can achieve unexpected behavior through self-learning chatbots, as it is shown here in the screenshot. So the user is asking, is suicide okay? And the system actually says something that we don't want the system to say. So it says, I'm going to say yes to that. But this is something we should avoid in healthcare applications. So that's actually a difficulty when implementing chatbots in the healthcare domain. But there are also other burdens of training data. So for example, we might be data might be unavailable for all potential subgroups, or the training data might be insufficiently sampled. So the last few words about the technology, which options do we have to implement conversational agents? There are scripting languages available that can be used to define these rules and patterns. So these scripting languages are basically for rule-based systems. As you recognize, this is like XML style language. You're specifying, for example, here a concept called name, then the pattern, and then some potential answers that the system might provide once it recognizes a name. There are a couple of such languages available: RiveScript, artificial intelligence markup language, or also synthetic intelligence markup language, and you will then need some kind of interpreter that interprets these languages. On the other hand, there are chatbot development frameworks from the big companies like Google, IBM. There's also from Nuance speech recognition software. They also have some framework. So there are a couple of such frameworks out there, and I just put here a screenshot from IBM Watson Assistant. So you are creating in these frameworks your dialogues in a quite intuitive way. You have nodes for your conversation tree, and then formulate again potential responses from the chatbot, and formulate intents that the system is expected to identify. What to consider when developing, in particular, a rule-based conversational agent is to involve users. So user-centered design is essential. I will show you a couple of examples later on, what we learned from users. So this is actually a publication that is currently just only available as preprint, but I thought it's very interesting. So in the design phase, you define a goal. So for a rule-based system, you have to be very clear about the goal so that you are able to really formulate the conversation flow. Then another important issue is to create an identity. So the chatbot is supposed to have an identity, and this should be carefully selected as well. And also the delivery interface, for which type of interface are you developing the conversational agent. Then in the development phase, you're developing the content and build the conversation flow. And finally, in the evaluation phase, we conduct usability testing, run pilot studies, and also study user engagement, acceptability, and so on. So now, this was the technical background. Now I will come to the examples. So there are a couple of applications of conversational agents in healthcare. Most of them have been published around mental health support, supporting behavioral change. For these types of interactions, there are a couple of conversational agents available, but there are also other application areas. So for example, health assistants that support users in nutrition, in losing weight, supporting medication adherence, or managing their disease. Also during COVID, but also before, there was a hype on developing symptom checkers based on conversational agents. And I will show you an example also for patient education that used a conversational agent. So I will start with chatbot, or actually a mobile application that integrates a chatbot for electronic medication management assistant. It's called Emma, and you will recognize that all these systems have some name. Often they are females. So this one is called Emma. It was a student paper here. And Emma is integrated in a mobile health application that provides information on the medication of a patient. In the chatbot, it's possible to ask, so the chatbot reminds the user to take the medication as prescribed by the physician. And it also asks for reasons of non-compliance. So why did you not take your medication as prescribed? So it's a kind of documentation of reasons of non-compliance. And it also allows the user to ask. So when I still don't know, why do I have to take this medication, I can ask Emma and she will give me the answer. The system integrates a couple of knowledge bases. So there's a knowledge base that contains all the instructions that are normally in the package inlet of medications. And we have, this is a rule-based conversational agent implemented with Rife script. Now I will show you Emma in action. It's in German, so I will translate a bit. So here it was welcoming me. She knows me already. And she says, well, there are no current reminders. Do you have any questions for me? Now I start the recording here. And I started with actually just greeting her and just say hello. And she is responding. And then I'm asking her which medications do I have to take. And she asked back whether she is supposed to show me my medication list, and she is opening this list. And this is now my medication list. And I stop here. I open the medication list and I see the information. So I currently have there 2 medications included. This is just against travel sickness. But I could have asked her also about this medication, and she would then just provide the information when to take it, why to take it, and so on. So this is Emma, and as here from this system and user testing, we learned that the people were confused, or they complained that Emma was responding so fast. So they're used to communicate via WhatsApp or other messengers, and their friends always take time, and you see these dots or some information that someone is writing, and Emma just posted the reply immediately, and this was something where the users complained about. They wanted to have it more human-like, so humans need time. So actually the students here implemented also these 3 dots or the information that Emma is writing. So this is some artificial slowing down the process of the communication. Then a second project, this is Anna, again, a female name of our conversational agent. Anna is supposed to collect the music biography of a person. The music biography is of interest during music therapy. Music therapy is the clinical use of music along with the relationship of therapists and patients to address a couple of medical issues, physical, psychological, social issues. And in order to be able to deliver music therapy appropriately, the therapist has to know more about the music biography of the person. So the therapist is interested in early experiences with music. For example, whether the person was listening to lullabies as a child, whether he or she played an instrument, whether she was singing, and also about experiences as youth and in other phases of the life. And last but not least, also on current habits in music consumption. So these questions were formulated as chatbot questions and implemented in Anna. So Anna is asking these questions. What we did here is that she's just asking the questions, but just waiting. And so there's sufficient time to think for the user. one specific thing here is that Anna is also providing support when the user does not understand the question. So this is something different with electronic questionnaire. For example, you cannot ask questionnaire to explain the question, but we can ask Anna to explain the question or what I'm supposed to answer here. So this is something, some support for the user. Anna also posted some motivational statements. As you can see, well, you cannot probably not understand German, but she says, well, you already completed half of the questions. Well done. So some motivation is posted from time to time to encourage the user to continue with interacting with the chatbot. We had different types of response types for the user. So there was a scale. There were predefined answers in buttons. There was free text. And for the free text responses, you could also use the voice recognition of the mobile phone. We evaluated Anna with a couple of users. In particular, we wanted to compare a paper-based data collection with the chatbot-based data collection, and we're interested in the answer relevance. So whether people are replying or are posting relevant answers in the chatbot, about the time. So is it faster to interact, to fill the questionnaire using the app or using the questionnaire? And about the motivation, whether the people are willing to answer additional questions on their music biography when they are using the app or the paper-based questionnaire. The results were actually, well, it did not make so many differences. So it was a bit faster to interact with the app. In terms of answer length, it was quite similar, whereas slightly shorter, and the answers were relevant, but we got many positive statements. So they liked the funny comments that Anna made. They confirmed that it helps you stay motivated. They had the impression to interact with a human. And this was also interesting. They confirmed that they would even trust Anna more than their doctor. So this was some interesting feedback. And we also learned something about an additional type of interaction. So the system was actually asking them for the lullaby the parents were singing when the person was a child, and she just started to sing, but actually our system was not able to capture this input. But this would be also something that could be integrated in this system easily to record the voice, to record the song for later use. Then a search system I want to show you is Claire. Claire is looking quite different than the other systems. It's a voice user interface. It consists of virtual reality and a voice user interface based on a chatbot with an integrated knowledge base. So it's used with a virtual reality glass. So it can be just a cardboard. You will see later in the video. And once you're in the virtual world, you can interact. So this gray ball is actually the character Claire. And when you look at her, you can talk to her. So what was the use case of Claire? Claire was supposed to support patient education in a virtual reality. So when you're going to a hospital, I'm not sure whether it's something Swiss specific or whether it's in all hospitals, people are asked to sign a general consent. So general consent is a consent that allows researchers to use patients' personal health data and biological material for addressing future medical research questions. So they don't yet know for which purpose they will use their data, but you are asked to consent anyway. So normally they provide information material, or you are allowed to ask the doctor, but they don't have time to reply to your questions. So that's why most often this consent is not signed by the patients. And so the idea was to develop such a virtual reality application that the patients can use at home. So the cardboard can be sent, it's not that expensive, it can be shared with the patients, so they can go and learn more about the patient, the general consent already at home, so that they are prepared when going to the hospital. As mentioned, this system is using virtual reality. So the virtual world was implemented with Unity. Then we have, again, a rule-based system. Chatbot's brain was implemented with synthetic intelligence markup language. So all the information on the educational topic was transformed to chatbot answers and implemented in this language. And then, yeah, we came up with a couple of questions that the user might have to really formulate relevant patterns. So speech recognition was implemented with Google text-to-speech and speech-to-text. And now I will show you also Claire in action. So there won't be some tone. So we will not hear her, but yeah, there's some text to read and I will explain the other things. So this is a cardboard, and you just place your smartphone in there. And then it's possible to, so at this point,
hello, welcome to my world.
Actually says, hello, welcome to my world. And then you can discover the virtual world and ask questions about the general consent. So the educational topic has nothing to do with this environment here. In this case, it's just supposed to look nice. And there's a document center where it's possible to also access the data, the information that has to be signed. And different parts of the world get opened once you have to ask a couple of questions. So the interesting thing about Claire was actually, so the student, the bachelor student, conducted also a test, not only with students, but he went to a shopping mall and just gave some people running around there the school cardboard, and they were so excited to interact with this world, and they really confirmed that they would love to do this, to inform themselves about a specific healthcare topic using this voice interaction. But of course, you can also use the virtual world also for educational purposes. In this case, it was just looking nice and had some gamification aspects actually. So there was no knowledge transferred through the virtual environment here. Yeah, so the examples I showed you before, the agent was actually not embodied. So this was just the agent had some characteristics, had some personality, but it was, you just learn about her personality when you're interacting with her. But here we have an example where there's an embodiment, so actually an avatar. And in this paper, this was interesting, they studied the impact of the appearance of the conversational agents to the adherence. And they found actually out that they had an older male agent and this young female agent, and they found out that the older male agent was perceived as more authoritative than the young female agent. So what we can learn from such studies is that it's actually important to assess the expectations of the users. So the look and feel of the virtual health assistant does really affect the user experience and even the adherence to some recommendations made by the health assistant. So assistants that show empathy or display nonverbal relation behaviors or also even disclose personal information about themselves achieve better user experience. So this is one important step also when designing these agents and these interactions between agent and user. Now I'm stepping again a bit back in technology. So I brought another example in terms of human-computer interaction. This is World Health Organization Health Alert for COVID-19. And here you can see already in the screen shot that the communication is really based only on keywords. So you're supposed to use these keywords or these icons to get information. And I will show you this. So this is actually not supposed, I'm not supposed to consider this as a human, right? This is just to access information. I wrote here latest, so I receive latest information, latest health information through this channel. And then I want to learn more about health, get some health information. So I'm just allowed to use, well, actually I did not try it, what happens when using other words, but I suppose nothing will happen. So you're supposed to use these keywords and then you will receive the corresponding information that is lying behind these rules actually. And this is a chatbot that is running on WhatsApp. So you can easily assign to it and just try it on your own. And the last example I want to show you is Raphael. Raphael is a chatbot that provides information about post-COVID, and it was developed in Switzerland at Geneva University Hospital. So this one is speaking French, so probably you will understand this. So here, maybe I stop. The system is mixing up approaches. So you might have seen the predefined answers where I just clicked on one information. I'm interested in information about adults, but I am also allowed to enter terms here when I want to escape from the predefined conversation flow. And here again, you see these three dots indicating that someone is writing, which might not be necessary actually. So now I'm just skipping this predefined conversation flow and write something I'm interested in. So I'm interested in symptoms of long COVID, and she is good. He is good. This time it's a male, and it lists, well, it points me to an internet page. And then I clicked on it, and it opens a page with all these symptoms where I can get more information. So here a service is integrated to open the web page or to access a specific part of the web page. Then I'm interested in getting some medical consultation about my post-COVID. And even though I'm quite lazy with writing sentences, she understood what I mean. So now again, I can select a predefined answer, and then she is pointing me to an appropriate internet page. So here you can see the different possibilities that can be combined in such a system. And this is also interesting. These systems often ask back whether they were successful, the information was helpful or not. Oh. So these were the examples I wanted to share with you to give you an impression of what kind of interactions are possible with conversational agents in healthcare settings. So my take-home messages are human-machine interaction in conversational agents provides multiple possibilities in terms of interaction. So we can design these interactions in multiple ways. The design decision really depends on the use case and your user group. So that's why you should consider also to involve users in the design process to ensure that you really develop something that is of help for the user group. Then what we learned that you should provide guidance to what users can expect. It was very comprehensively done in the World Health Organization chatbot. So they clearly said which terms you can use and which kind of information you receive. When we started with developing conversational agents, we just started writing hello, and then the user was did not know what to do. What can I ask the system? What can I write? What will it understand? So they don't want to be frustrated by irrelevant responses. So provide guidance what they can expect and how they can interact. And we also learned in our project that's in terms of user experience relevant to really mix interaction options. So have some free text, replies, but also predefined answers and so on. So that says it's really just nice to interact with the agent. Another issue is to really integrate it in workflow when developing conversation agents for healthcare settings. So this is here how we want to include actually a medical history chatbot for radiology and the radiology workflow. So the chatbot is collecting the medical history from the patient. The conversation protocol is automatically structured and transformed in some protocol that is included in the electronic health record from the patient. And the radiologist can access this information when the images are available and can use this information from collected by the chatbot during the finding process. So really also think about how to integrate your system in the workflow. And last but not least, don't forget about technical evaluation of your chatbot in healthcare. So in healthcare, we have to really take care of the patient safety. So it's necessary. So we find a lot of studies on conversational agents dealing with usability and user experience, but there's almost nothing assessing really technical aspects, like for example, the quality of the content that is integrated into the system, about error handling. So what happens when something is wrong, unexpected user input occurs, and so on. So a couple of technical aspects that might be evaluated before we test the system in patients or use them in really healthcare settings. And this is the end of my presentation. I finish with an image from Biel in Switzerland, where I'm currently not, but you can see the mountains of Swiss Alps here. So thank you for your attention, and I'm looking forward to your questions.